Very good evening, guys. Welcome to the platform. So, I am Dr. Ramya Sree, your OBGYN Guru. So, in the coming days, we are going to finish obstetrics and gynecology. My main motto and my main aim will be that you should be learning the subject perfectly, and by the end of these sessions, you should be in a position to tell me that I am so confident in obstetrics and gynecology. That will be our main motto. So we are going to do workbook based. So whatever the spaces provided, I'll guide you how to write and where to write, right? So it will be easy for you. The only thing is that every day we are having a 5 hour session. So post session, I want you to read the topic that same day. And next day, try to solve the MCQs based on that topic. That way you will finish the topic. So small. So आज you have studied with me, finish that topics, and then tomorrow solve the MCQs. So I want that 100% dedication while you're preparing for the obstetrics and gynecology with me. So I'm going to give my 100%. I want you also to give your 100% so that we'll all finish obstetrics and gynecology in a perfect manner. And whatever the notes which I'm going to provide to you, that is more than enough for you to rock in your exam. You will aram se score very good. Like if there's 25 marks, 23 to 24, nobody can stop you from getting. One question will be always a googly, so that you should never break your head, and how much ever you read that we cannot answer, right? So one question doesn't matter, but the rest 23 to 24 you can aram se score, right? So I want all of you to actively participate in the session and keep answering. So everything is clear, audible, visible, everything is clear. Okay. Am I audible and visible to all of you? Can you just give me a message? Can you give me a thumbs up whether I'm audible and visible to all of you? I spoke so much. I hope I was audible and visible. Right. At any point of the time in the entire session, if you don't understand anything, no, I'm not audible and visible. Very good evening, Asim. Very good evening, surgeon. So just give me a second so that it is audible and visible to everyone. So welcome guys, welcome back. So I've given an introduction about the topics and what we are going to do every day. Now those who are joining now, I repeat once again, our main motto for the entire sessions will be that whatever topics I teach you today, you will, I know the by the time the class ends it becomes a little late, but before I start tomorrow next day's session, you will make it a point that you revise those topics as well as you try to solve the MCQs based on those topics. I want you to do only this much, and then I tell you that aram se you will finish this subject and it will become a cakewalk to all of you. And I want all of you to do active participation throughout the subject when we are revising and when we are doing, right? And at any point of time, if you don't understand any point, feel free to ask me. So the first topic which we are going to start, is gametogenesis. That is, what are the two gametes? So what are the two gametes? So obviously the sperm and ovum. So the formation of sperm and ovum is what I'm going to start with. Anatomy I will discuss in the gynecology. Here we are going to start with the gametogenesis, that is the sperm and ovum, right? Now, sperm and ovum develop from where? Sperm and ovum develop from where? So sperm and ovum will develop from the germ cells. So I want you to jot down from the gametogenesis. So germ cells first appear in the yolk sac. Germ cells appear in the yolk sac. Germ cells are formed from the epiblast at second week. So the point number one, germ cells are formed in the epiblast at second week. Right? These germ cells from the epiblast travel to the yolk sac. Now, germ cells are bipotential. This can either become sperm or can become ova. There is a deciding factor which will decide whether this germ cells will become sperm or whether this germ cells will become ova. Does anybody know what is the deciding factor? So once these germ cells go into the gonadal ridge, there is something called SRY gene, which I'm going to again discuss in detail while I'm doing the embryology for you all in gynae. Okay? So germ cells are formed in the epiblast at around second week. Okay? Third week. So at around third week, germ cells move through the primitive streak to reach the yolk sac and migrate to yolk sac. So at around third week, germ cells, what they'll do? Germ cells will move through the primitive streak and they'll reach the yolk sac. From the yolk sac, germ cells will go to the hindgut. This is the hindgut. See, they'll go to the hindgut, and from hindgut they'll go into the gonadal ridge. This is the gonadal ridge. So actually, gonadal ridge will be in the abdomen. Then the gonads will descend down, right? So I want you to write the next point as fourth week germ cells migrate from yolk sac to gonads through dorsal mesentery of hindgut, but you know they don't ask you so much question. So germ cells migrate from the yolk sac to gonads at around fourth week. So fifth week they reach the gonads. Germ cell migration is complete. So you got a question ki when do we see the bipotential gonads? So bipotential gonads are seen at around fifth week. Bipotential gonad are seen at around fifth week, right? Okay. So did you all understand this basic points? So I repeat once again what I've discussed here. Germ cells are formed in the epiblast at around second week. Germ cells are formed in the epiblast at around second week. Third week, germ cells move through the primitive stick and migrate to yolk sac. So at how many weeks they reach the yolk sac, guys? Third week, they reach the yolk sac. Fourth week, germ cells migrate from the yolk sac to the gonads. Fifth week, they are now in the gonads. So there was one question ki when do we see bipotential gonad? Bipotential gonad is seen at around fifth week. Now what do I mean by bipotential gonad? What do I mean by bipotential gonad? Bipotential gonad means they can either become testis or they can either become ovary, right? Okay, now who is very complicated? Girls are very complicated or boys are very complicated? A simple question I'm asking you all. Who is very complicated? So are you all going to communicate through the telegram group itself, right? So I'll be looking in the telegram group for you to communicate with me, right? Yes. Who is very complicated? Soham, who is very complicated? Girls are very complicated or boys are very complicated? Yeah, I think you're correct, Yuvraj. So, yeah, even I do agree. So, girls are little complicated compared to boys. So, very good. All of you are absolutely correct. Now, we have two things in the gametogenesis. One is spermatogenesis, another is oogenesis. Both spermatogenesis and oogenesis take only 3 steps, that is mitosis, meiosis 1 and meiosis 2. But spermatogenesis occurs very quick and there will be millions of the sperms which develop. But oogenesis takes lot of time, right? So first we'll discuss spermatogenesis or male and then we'll go for the oogenesis, right? So you can write down in the workbook near the spermatogenesis itself. So where does the spermatogenesis take place? Obviously, spermatogenesis takes place in the testis. I want you some basic points I'll tell you about the testis. What are the two components in the testis? What are the two cell components in the testis? So we have interstitial component and we have the Sertoli cells, right? So we mainly have two cells. One is Sertoli cells and another is Leydig cells, right? So outside, what are these cells which form the blood, uh, the testicular barrier, blood testis barrier? They are the Sertoli cells. And outside will be the Leydig cells. Leydig cells will be outside, whereas Sertoli cells will form the blood testis barrier. Correct? So we have two components. When you do the cut section of the testis, you will see two components. One is interstitial compartment. Another is seminiferous tubules. Okay. So what do we have in the interstitial component? In the interstitial compartment, we have the Leydig cells. And these Leydig cells secrete testosterone, which is responsible for the spermatogenesis. You also have fibroblasts and neurovascular tissue, but most important in the interstitial component is the Leydig cell, which releases the testosterone. So LH stimulates the Leydig cells to release testosterone, which helps in spermatogenesis. Correct? So what is, see, if you see the testis, this is the, this inside wala part is your seminiferous tubule wala compartment. Outside to this, you will have the cells. Those cells will be the interstitial component, and it will be nothing but your Leydig cells, which will secrete the testosterone, which is very important for the spermatogenesis to take place. Right? Now, seminiferous tubules contains what? So, seminiferous tubules contain Sertoli cells. Sertoli cells secrete inhibin B and androgen binding protein. ABP I am writing. Androgen binding protein. Okay. So I'm just changing the slide. Very good, Soham. Excellent. So I'm changing the slide. Now I want you to also write down that Sertoli cells Sertoli cells form the blood testis barrier. So what is the role of this blood testis barrier? This blood testis barrier mainly protect the germ cells, preventing them from any harmful agents affecting. So it is present around the germ cells so that they are unaffected by hormones. Where else do we have such where else do we have some such tight barriers apart from here? Where else do we have such tight barriers? You can think of some more barriers like this. At least tell me the most important barrier what we have. So Sertoli cells are forming the blood testis barrier, right? Can you tell me any other barriers? Yes, excellent, Bharat. Blood brain barrier. Blood brain barrier is is very important. Again, that also mainly plays role from preventing the harmful agents coming inside, right? So another important is blood brain barrier. Next, even placenta also is similar type of barrier itself, right? Very good, very good. So we also have it in the blood brain barrier, and yes, thymus also. So these are some of the important points which you should know. Now let us discuss about the spermatogenesis. Spermatogenesis. Now actually ideally you should be see, you have to write the spermatogenesis everything here itself. So try to accommodate accordingly. Okay. So spermatogenesis. So first we have the spermatogonium. Spermatogenesis में first you will have the spermatogonium. Spermatogonium will undergo mitosis. You got this sequence as an MCQ in one of your PYQs. So you can put a star. So whatever we put a star and which has been asked previously, last minute revision when you're doing, those are the points which you're going to look and go forward for your exam. Okay? So spermatogenesis sequence is a star because they have asked as an MCQ. So spermatogonium will undergo mitosis to form primary spermatocyte. This will undergo meiosis 1 to form secondary spermatocyte. This will undergo meiosis 2 to form spermatid. Let me just enlarge this part. So spermatogonium will undergo mitosis to form primary spermatocyte. This will undergo meiosis 1 to form secondary spermatocyte. That will undergo meiosis 2 to form the spermatid. Now tell me, what is the reduction division among these all? In which one number of chromosomes will become half? In which step number of chromosomes will become half? Meiosis 1 is a reduction division. In meiosis 1, number of chromosomes will become half. Meiosis 1 is a reduction division and meiosis 1 mein number of chromosomes will become half. So spermatogonium will be 46 XY. Primary spermatocyte number of cells will be cells will be the same, right? So this is also 46 XY only. Number of chromosomes will be same. But secondary spermatocyte, number of chromosomes will become half. Ask you both meiosis, number of chromosomes will become half. But अगर कोई particular पूछता है, then go for the meiosis 1. Go for meiosis 1. ठीक है? So secondary spermatocyte will be either 23X or 23Y. Spermatid are round cells. These are also 23X or 23Y. Now the MCQ what you got was, they asked what is the sequence of the cells from lumen to the wall of the testis. Guys, if the question comes, what is the sequence of the cells from the lumen to the wall, then what should be your answer? If they ask you from lumen to wall, then what should be your answer? Just write the first क्या होगा, last क्या होगा, बस इतना ही लिखना है. I want all of you to actively participate. Every day, all of you will be actively participating along with me. That's the only request I have for all of you. So from spermatogonium to spermatid, what will be the sequence from lumen to wall? Excellent, Soham. Very good. Very good. So if they're asking you from the lumen to the wall, guys, see this previous picture. Lumen may you will have the sperms. That too, you know, sperms will enter, the tail will come out first. Then the head gets released. So first will be the tail which comes into the lumen and then the head will come. है ना? So if they ask you, what is the sequence of the cells, I am asking. Sequence of the cells from the lumen to the wall of the testis. So lumen mein sperm will be there. Then spermatid. Then secondary spermatocyte. Then primary spermatocyte. Then spermatogonium. So you have to answer from here to up. So this was a PYQ. If you answer from spermatogonium to sperm, gone, right? So it should be from sperm to spermatogonium if they ask you from lumen to wall. ठीक है? Understood, NS? Right? If the question comes from the wall to lumen, then it will be from spermatogonium to sperm. If lumen to wall matlab ulta, sequence ko yaad rakhna, lumen to wall will be ulta. So first will be sperm and then last will be spermatogonium. So this is the wall of the testis, this is the lumen of the testis. Seminiferous tubules ka lumen. All of you understood the sequence? Okay, done. Right. Now, we know that spermatids have to transform into sperms. Spermatids transforming into sperm is called as spermiogenesis. Spermiogenesis. See, this is a spermatid. This spermatid transforming into sperm is called as spermiogenesis. Spermatid transforming into sperm is called as spermiogenesis. If you do electron microscopy, this is how the sperm looks like. How are you going to identify the sperm? On the electron microscopy, tail. It has a head, neck and tail. Okay. See, these are all round cells. Some round cells will be there. But you should see maximum normal sperms. Then we call it as semen analysis normal. Anyway, we have a criteria for semen analysis also. Okay? Right. So, next, write down spermiogenesis. Spermiogenesis means spermatid transforms into sperm. So what in the spermatid transforms into what? So if you see here, the nucleus will become the head of the sperm. First I'll just show you in the picture and then we'll write it. Okay. The nucleus will become the head. The Golgi apparatus will become the acrosome. Mitochondria will become the middle piece. Centriole, these small centrioles will become the tail. That small centrioles will become the tail. Okay. So nucleus will become head. Golgi apparatus of the spermatid will become the acrosome. Centrioles will become the tail. Mitochondria will become the middle piece. What is the main ion which is required for the movement of the sperm? What is the main ion which is required for the movement of the sperm? This is actually a simple question because this is the main ion which is required for any movement, muscle movement, sperm movement, any movement. This is the same ion which is required. So what is the ion which is required for the movement, guys? I'm waiting for you all to answer. Yes, excellent. Very good, Yuvraj, Soham. Correct. Calcium. Calcium is the main ion which is required for the movement of the sperm. Right? Now, every cycle of spermatogenesis, you actually have millions of sperms released at the end. Okay? This millions of sperm have tagda competition. These millions of sperms are competing for how many ovums? One ovum. Dulhe anek. Dulhan ek. Right? So I want you to write down some single liners. So you have the space here, the first page, the first page what you got in your workbook, you can write it there. If you're writing it in the workbook itself, then first page of the workbook, you write down some single liners. Spermatogenesis starts at puberty. Spermatogenesis starts at puberty. You're all interns, right? Or any final year exam going students also, or all of your interns? So spermatogenesis starts at puberty. One spermatogonium. Okay. One spermatogonium gives rise to 16 primary spermatocytes. One primary spermatocyte gives rise to 4 sperms. So spermatogenesis starts at puberty. One spermatogonium gives rise to 16 primary spermatocytes. Each primary spermatocyte will in turn give rise to 4 sperms. So one spermatogonium is giving rise to how many sperms? Okay, I understood. It's a mixed batch. So I asked because final year students should give final year exams also, no, theory exams also. So I will tell the points for the theory exams also, right? As well as in the NEET perspective, both I'll be telling you. Don't worry. Okay. So one spermatogonium is giving rise to 16 primary spermatocyte. One spermatocyte is giving rise to 4 sperms. So one spermatogonium is giving rise to how many sperms, guys? Very good. Excellent, NS Raj. So it is going to give rise to 64 sperms. 64 sperms. Correct. Correct. Right. Now, on a Valentine Day, if the Valentine date should be successful, who should wait for longer time? Girlfriend or boyfriend? So now in the fallopian tube also you'll have a date between ovum and sperm. So who should wait for a longer time for the date to be successful, matlab fertilization to take place? Girls should wait longer time or boys should wait longer time? It's a easy question, yeah. So obviously boy should wait longer time for the date to be successful, correct? So here also we have the sperm and ovum. So if the fertilization should take place, sperm should wait longer time. So what is the lifespan of the sperm? To remember the lifespan of the sperm, you're absolutely correct. Excellent. All of you are correct. So similarly, the lifespan of the sperm is 72 hours. Whereas the lifespan of the ovum will be 24 hours. Right? So size of the sperm is very small. It is only 55 microns. 55 microns. So size of the sperm is 55 microns. The days taken for the spermatogenesis. So everything with the sperm, you can remember it as 72. 72 days. Whereas spermiogenesis takes around 10 to 14 days. So this is everything which you should know with respect to the spermatogenesis and spermiogenesis. So I'll quickly recap this entire thing what we have discussed. I want all of you also to ask if you have not understood anything. What is the important MCQ here? The important MCQ here is the sequence. Sequence is the most important. Okay? Chalo. We'll quickly recap this entire thing. Yeah, one more very, very important point. Maturation, motility of the sperm. See, spermatogenesis and everything is taking place in seminiferous tubules. But sperms, when released into the lumen, they are not completely motile. So, motility of the sperm is attained where? So, motility of the sperm is attained in epididymis. Motility of the sperm will be attained in epididymis. Okay? Right. So when does the spermatogenesis start? I will ask you, keep answering. At least answer the first word, I'll understand. I want all of you to, whoever is listening the class should be active here, right? Not only Soham, NG and Bharat, Aman, Vipul, everyone, Aryan. So when does the spermatogenesis start? It starts at puberty. It starts at puberty, right? Where does the spermatogenesis take place? Where does the spermatogenesis take place? So if somebody asks you motility, then answer epididymis. If there's somebody asks you where does it take place? Seminiferous tubules. Seminiferous tubules, right? What is the most important gonadotrophin which is required for the spermatogenesis to take place? What is the most important gonadotrophin for the spermatogenesis to take place? So I didn't ask what is the most important hormone. I've asked what is the important gonadotrophin. So LH is important for the spermatogenesis to take place. Why LH? Because LH is the one which is going to stimulate the Leydig cells to secrete testosterone. So LH. Right, correct. Very good. All of you are answering very well. Excellent. Right. Next up. How many sperms are, what is the reduction division? Which step to which step the number of chromosomes will become half? Spermatogonium to primary spermatocyte to secondary spermatocyte to spermatid, yes, spermatid to sperm. Yes. So meiosis 1 is a reduction division. So primary spermatocyte to secondary spermatocyte is a reduction division. Correct. Absolutely correct. Very good. Excellent, all of you. Chalo. Let's go to the next one. Do you know what is the other name for the Sertoli cells? See, sometimes they might not give you the name of Sertoli cells. Do you know the other name for the Sertoli cells? Sertoli cells are also called as sustenicular cells. Sustenicular cells. So here in the picture you have the name, see, sustenticular cells. This is nothing but the Sertoli cells. Correct. Excellent, Dev. They are nothing but the Sertoli cells. Right? Okay. Right. Next point I want to ask you is, what are the cells which are outside the loom, which are outside seminiferous tubules? What are the cells which are outside the seminiferous tubules? So the cells in the interstitial part are Leydig cells. Leydig cells. Whereas what are the cells which are inside? Those are the Sertoli cells, right? Now, you all understood the spermatogenesis. Spermatogenesis may millions of sperms are developing, and those millions of sperms are targeting only towards one ovum. मतलब कितना horrible competition है. अब इतना ज्यादा competition है तो sperms को, if they want to win, they have to move faster than the other sperms. So now the dulha should get extra touch up. That extra touch up of dulha is called as capacitation. Matlab sperm will become hyper motile. Zup. Right? So if they're only motile, it is not going to help. When they're motile, they'll reach the vagina. From vagina, if they have to reach the fallopian tube, now they have to undergo something called as capacitation. Capacitation. So in your workbook, already capacitation is written. You can just follow in your workbook. So capacitation is sperm becoming hyperactive. Sperm becoming hyperactive is called as capacitation. Sperm hyperactivation is called as capacitation, right? Not only in capacitation sperms will become hyperactive, but also the acrosomal content. In the acrosome, they start developing an enzyme called hyaluronidase so that they can pass through the corona radiata and zona pellucida, right? There are two things which are happening in capacitation. One is sperm will become hypermotile, and it also gets the ability to release acrosomal content. Release the acrosomal content. There are two things happening in the capacitation. All of you understood the capacitation, right? Where does the capacitation take place? Where does the capacitation takes place? So capacitation takes place in the female genital tract. So it occurs in female genital tract. Maximum at fallopian tube. Time taken for capacitation? 6 to 8 hours. Time taken for capacitation is 6 to 8 hours. Right? So, millions will enter inside the vagina, but only hundreds will pass through the cervix. And then those hundreds will now reach the fallopian ovum. And once they reach the ovum, they first attach to ZP3, zona pellucida 3 receptor. And they pass through something called as corona radiata. See, can you see these cells? These are corona radiata. They will pass through the corona radiata and then they reach the zona pellucida layer. ठीक है? Capacitation के बाद what will happen is they pass through the corona radiata and then they reach the zona pellucida. Zona pellucida is a hard layer which is present around the ovum. Once they reach the zona pellucida, the acrosome of all these sperms will start secreting. See, this acrosome is there, no? This acrosome will start secreting. Anybody, what is the enzyme which will be secreted? It starts secreting hyaluronidase enzyme. And this hyaluronidase enzyme, what will this do to the zona pellucida? It will dissolute the zona pellucida. It will dissolute the zona pellucida. Okay? So, that we call it as acrosomal reaction. So, after capacitation, what is the next step? There will be acrosomal reaction. Hyaluronidase released from acrosome of sperm to dissolute zona pellucida. Once the zona pellucida dissolves, one sperm, the plasma membrane of the sperm fuses with the plasma membrane of the oocyte, ulima, and one sperm nucleus along with the mitochondria and all will enter the perivitaline space. As soon as one sperm nucleus enters inside, immediately, can you see here? These are called cortical granules. These cortical granules are released and then again it leads to hardening of zona pellucida. अच्छे से समझने की कोशिश करो. First, to survive, to become the best, they'll become hypomotile. Once they become hypomotile, they'll go reach the ovum. All will go attach the ovum and they'll start producing hyaluronidase enzyme. Once they produce hyaluronidase enzyme, what is happening next? All will try to dissolute the zona pellucida. Once zona pellucida is dissoluted, one sperm nucleus enters inside. Then what will happen next? There will be cortical granules released. That cortical granules when released, it will lead to again hardening of zona pellucida. ठीक है? So after acrosomal reaction, what you should write? One sperm nucleus, only one sperm nucleus can enter inside. Nucleus enters perivitaline space. There will be release of cortical granules. This release of cortical granules is called as cortical reaction. What will cortical reaction do? Cortical reaction in turn will lead to hardening of zona pellucida. So hardening of zona pellucida is called as zona reaction. Hardening of zona pellucida is called as zona reaction. Guys, can you tell me what is the role of again hardening of zona pellucida? Why does the zona pellucida again get hardened? To prevent what? Hardening of zona pellucida further will lead to what? Excellent. To prevent polyspermy. To prevent polyspermy. Correct. Excellent. So hardening of zona pellucida will lead to prevention of polyspermy. Just write that point. No, it helps in prevention of polyspermy also. Hardening of zona pellucida is called as zona reaction. So this is everything what we should know with respect to the different reactions. So if you understand something very beautiful here, millions of sperms have competed for one ovum, and among those millions of sperm, one sperm has won, rest all have lost, and that one sperm which has won resulted in a zygote, which is you. So I always tell you, you have already won one very big competition. Millions में, लाखों में नहीं. I don't know what we call millions in Hindi abhi. So millions में एक जो है, that is what we got. So opportunity of life is very precious. You know, we are got this human birth is not simple. We have already competed. So we are already a winner, yeah. Now everything else is a cakewalk. So I'll tell you some nice points like this. So अभी दुल्हा रेडी है, अभी दुल्हन के बारे में बात करेंगे, that is oogenesis. Now before I go to oogenesis, I want all of you to write in the comment box what is the sequence of the reactions. I told so many reactions, no? Can you tell me which reaction comes after which reaction? I'll give you 4 names. I want you to arrange which reaction comes after which reaction. So I will randomly write the reactions. You have to write in order. cortical reaction, zona reaction, acrosomal. Wait, I'll write A, B, C, D so that you can arrange it accordingly. Cortical, zona, acrosomal, capacitation. Now write the arrange it in the sequence. What will happen after what? You can write D. You can write with the D, A, B, C, D के हिसाब से. Right. If you have joined the D also, then it will be very good. D, C, A, B or B, A. Okay, let me see. So first will be capacitation. First will be capacitation. Correct. After capacitation, acrosomal reaction. Correct. Absolutely correct. After acrosomal reaction, then comes the cortical reaction. Correct. ये भी correct है. उसके बाद आएगा zona reaction. Correct. Hardening of zona pellucida is the last what is happening. Absolutely correct. So D, C, A, B is the correct order. Chalo, let's go to the next one. Oogenesis. Okay. Now I have my way of teaching. So normally we have two terminologies. One is folliculogenesis, another is oogenesis. I teach folliculogenesis in gynac, guys. I don't teach it here. I teach it in the gynac. Okay. So while you're solving questions, if you get questions from folliculogenesis, don't panic. I also discuss folliculogenesis, but I discuss that in gynac. That's the only thing. Why am I telling this is क्योंकि आज क्लास खत्म होने के बाद आज के टॉपिक्स you will study and you will solve the MCQs on that topic today itself. Pick up any standard booklet, whatever you have, start solving the questions. Hardly, I tell you, hardly it will take 1 hour to revise, half an hour to solve the questions. 1.5 hours, that's all. Whatever 5 hours class I'm telling, you can revise it in 1 hour, provided if you are listening to me now. I want 80% to be grasped here today in the class itself. Okay? Right. Very good. So, oogenesis, folliculogenesis, ovarian cycle, all these students don't have a proper clarity. They'll think all this is same terminologies. Nahi. All these are alag-alag. ठीक है, सब कुछ अलग अलग है. oogenesis अलग, folliculogenesis अलग, ovarian cycle अलग. अभी के लिए what I want you to remember is ovary, when you do cut section, ovary will have multiple follicles, guys. Ovary will have multiple follicles, and these multiple follicles will be in different stage. ऐसा नहीं कि all of them are in same stage. All of them will be in different stage, and in each follicle you again have this oocyte. So what I tell is, think that follicle is like a balloon, oocyte is like a marble inside that. ऐसे imagine करो कि follicle जो है, that is balloon. When I am telling the development of balloon, it is folliculogenesis. Oocyte क्या है? Oocyte is like a small marble inside that, which is germ cell. Follicle is germ cell or oocyte is germ cell? Oocyte is the germ cell, right? Chalo. Now what I'm going to discuss is development of germ cell, that is oogenesis. Development of germ cell, that is oogenesis, right? Now who does lot of मतलब कौन मतलब जो चल रहा है चलने दो भाई, मस्त है, और कौन 10 साल के बाद बच्चा क्या करेगा, वैसे कौन सोचता है? कौन अभी का अभी रहता है, कौन बहुत फॉरवर्ड सोचता है? गर्ल्स फॉरवर्ड सोचते हैं या बॉयज? again I feel boys are at present, इसीलिए स्पर्मेटोजेनेसिस प्यूबर्टी में स्टार्ट होना था, प्यूबर्टी में स्टार्ट हो रहा है. बट oogenesis starts in utero. Oogenesis should ideally start when puberty mein, but when does oogenesis start? Oogenesis starts in utero. So oogenesis starts at 8 to 9 weeks of intrauterine life. Yes, Yuvraj, excellent, correct. 9 weeks of intrauterine life. Too much, no? Do you want any baby, any girl baby, as soon as she's born to have the ability to reproduce? Then I think India will talk more further. So first we have the oogonium, which will undergo mitosis to form primary oocyte. Oogonium will undergo mitosis to form primary oocyte. This primary oocyte, this happens in utero. Then suddenly this follicle, so this follicle is covered by granulosa cells. Follicle is covered by granulosa cells. These granulosa cells secrete meiosis inhibiting factor. So this granulosa cell which is present in the follicle is made up of granulosa cells and theca cells. This granulosa cell is like motherly. अभी वो like अरे क्या चल रहा है? Why should she reproduce as soon as she is born? So these granulosa cells will secrete something called as meiosis inhibiting factor. Meiosis inhibiting factor, right? So these granulosa cells arrest primary oocyte in dictate stage of diplotin stage of meiosis 1. Personally, if you ask me, ma'am, should I remember so many names? No. They have never asked, except for while you're practicing, you might read this dictate diplotin stage. If you can't remember so much, final exams, I have never seen any neat questions where they have particularly asked those stages. So at least remember it is arrested in prophase of meiosis 1. Diplotin stage of prophase of meiosis 1. So it is arrested in dictate stage here, diplotin stage of prophase of meiosis 1. That too, how do I remember is, I remember that primary oocyte, everything will be first. Primary oocyte is arrested in prophase. It is arrested in which meiosis? Meiosis 1. So primary oocyte ka sab kuch remember first. Did you all understand till here? So oogonium undergoes mitosis to form primary oocyte. Then हमारा granulosa cell क्या करता है? It will release something called as meiosis inhibiting factor. So it releases meiosis inhibiting factor. Meiosis inhibiting factor. What will this meiosis inhibiting factor do? It will arrest the primary oocyte in dictate stage या diplotin stage of prophase of meiosis 1. When do you want this primary oocyte to again start reproducing? Yes, Yuvraj, Bharat, Soham. Himanshu, Aman, Aryan. When do you want the meiosis 1 to resume back again? Yes, excellent. At puberty. At puberty. Correct. So at puberty, there will be resumption of meiosis 1. Do you know which is the gonadotrophin which helps in this resumption of meiosis 1? By LH, luteinizing hormone. So 10 to 12 hours. We all know that meiosis 1 is reduction division. So 10 to 12 hours prior, first polar body is released. At ovulation, secondary oocyte released. At ovulation, secondary oocyte is released. Okay? Secondary oocyte is arrested in second phase. Secondary oocyte is nothing but the ovum, guys. Secondary oocyte is nothing but the ovum. Secondary oocyte is arrested in second phase, metaphase of meiosis 2. It is arrested in metaphase of meiosis 2. Secondary oocyte will resume back its meiosis 2 at the time of fertilization. So at fertilization, it releases female pronuclei. After fertilization, it releases second polar body. That's about the oogenesis. Now, actually, this is very easy to remember. How do I remember? I'll tell you. It's confusing, no? Which phase arrest, which polar body, and all that. I remember that first primary oocyte, everything is first. Secondary oocyte, everything is second. Primary oocyte is arrested in which phase, guys? Prophase, which is first phase. And which meiosis? Meiosis 1. Prophase and meiosis 1. Secondary oocyte is arrested in second phase. Secondary oocyte is arrested in metaphase, meiosis 2. First polar body is released after the primary oocyte divides. Second polar body is released after meiosis 2. Easy, remember that way. Then it will be easy for you to remember. Okay? Now let me see if you have really understood this. I will ask you one question. What is ovum? Female pronuclei is ovum, या secondary oocyte is ovum? Yes. Very good, Archit. Secondary oocyte is the ovum. Secondary oocyte is the ovum. Correct. Correct. Okay. Next question. If you do cut section of ovary, what are the cells which you are going to see? Oogonium, primary oocyte, or secondary oocyte? If you are going to do cut section of the ovary, at birth, what are the cells which you are going to see? Oogonium, primary oocyte, secondary oocyte. No need to write full, just write 1 या 2 या oogonium. That's all. Very good, excellent, Gurleen. Correct. See, if I'm going to do cut section of the ovary, then I'm going to see in all follicles primary oocyte. Because primary oocyte will be in arrested state till puberty. Correct. Excellent. Absolutely correct. So if I write the number of chromosomes, oogonium will be 46XX. Primary oocyte also will be 46XX because it is mitosis. But first polar body and secondary oocyte will be 23X. Female pronuclei and second polar body also will be 23X. Now next, one more point I want you to know here is, at 5th month of intrauterine life, we have 6 to 7 million primary oocytes. Among these 5 to 6 million or 6 to 7 million, 6 to 7 million primary oocytes, at birth it becomes 1 to 2 million. Among this 1 to 2 million, at puberty you will have 4 to 5 lakh primary oocytes. Among these 4 to 5 lakhs, only 400 mature throughout the woman life. Among these 4 to 5 lakh primary oocytes, only 400 mature throughout the woman life. Only 400 mature throughout the woman life. Rest all will undergo atresia. Actually, at menopause also we have 1000 primary oocytes, but they don't have the ability to mature or become the ovulation and dominant follicle. They don't have that ability. So we have only precious 400. Only 400 primary oocytes mature throughout the woman life. What do you call that stage when all these 400 primary oocytes get depleted? What do you call that stage in the female? When all these 400 primary oocytes deplete, what do you call that stage in the female? If all those, yes, it's called menopause. It's called menopause. So like you see many people मतलब आजू बाजू बोलते रहते हैं कि एक टाइम एक एज होता है शादी करने के लिए, एक एज होता है बच्चे होने के लिए, right? People keep telling, is it sign? I know that social pressures are there, but scientifically, is it correct, apt scientifically for a woman that there is an apt age for getting married, apt age for getting having kids? Is it valid for a woman? First you answer women, then I'll also ask you about men. Yes. So scientifically it is true. For a woman, there is an ideal age to get married and ideal age to have kids. Why? Because as our age increases, what will happen? Our oocytes will deplete. And the quality of the oocytes are best during 20 to 30 years. But once we cross 35, the quality of oocytes will become bad. And we are more prone for having aneuploidies. And slowly, once we cross 40, oocytes are in its last reserve, so there is more chance of having infertilities. Correct? So now what is happening nowadays to compensate for all this? So we have oocyte freezing. In the young age, what girls can do is they can freeze the oocytes so that when they are mentally prepared, yes, they can freeze the oocytes. Absolutely correct. Okay, now one more thing. Do men also have correct age to get married and correct age to have kids? Do men have sperm count deficiency as the age increase? Not much more for the men. So the millions of sperms can keep can keep forming even up to 70 years also. So for men you will not have that problem, right? So till here you understood about the female as well as male development, the gametes, that is spermatogenesis and oogenesis. So you all understood about spermatogenesis and oogenesis. So what is fertilization? Fertilization is fusion of male and female pronuclei. So fertilization is fusion of male and female pronuclei. So this results in zygote. So zygote will further divide into 2 cell, 4 cell, mitosis. It undergoes continuous mitosis. 8 cell, and then day 3 post fertilization. Day 3 post fertilization, we have 16 celled morula. Day 3 post fertilization, we have 16 cell morula. This is important. Day 3 post fertilization. If I ask you from LMP, then you have to add another 14 days, guys. This I am writing day 3 post fertilization. But if I ask you from last menstrual period, it will become day 3 plus 14, that is day 17 morula is formed. Day 3 to day 4, morula enters the uterine cavity. Morula enters the uterine cavity. This morula, which is 16 cell, there will be fluid seeping into this morula. And then on day 5, blastocyst develops. Day 5, morula में fluid will fill and blastocyst will develop. So what happens in blastocyst? All the cells will come to one side and there will be a fluid filled cavity and some of the cells will go outside. That is called trophoblast. So this is the trophoblast. This is called inner cell mass. This is the antrum. So day 5 blastocyst will develop. Fluid will enter into the morula and day 5 blastocyst will develop. Day 5 there are two things which are going to happen. One is blastocyst will develop. Second, this blastocyst is covered by a zona pellucida. That zona pellucida will get hatched, will dissolve. That's also called as zona hatching. So can you see here? So day 5 you will also have zona hatching. That is dissolution of zona pellucida. See, why is it important that this zona pellucida should dissolve now? Can you think clinically, मतलब इसका importance क्या है? Zona pellucida भी dissolve क्यों होना चाहिए? Can you think? Yes, I want you to understand this subject very beautifully in a clinical manner with concept. Then it will be a cakewalk for you to solve the MCQs. Just don't by heart what is happening on day 4, day 5. No, understand it. It's very beautiful. You can understand. So day 4, Sare cells, the morula is entered inside. Excellent, Archit. Very good, Archit. If zona pellucida is there, it is hard. It cannot penetrate inside and get implanted. Yes. So that is why day 5, zona pellucida will dissolve. So that day 6, what can happen? Day 6, implantation will happen. Correct. So if zona hatching doesn't take place, implantation also won't take place. So zona hatching is important so that implantation takes place. Very good. Excellent, guys. I appreciate. Now, this trophoblast is, you have 53 cells of trophoblast and we have 5 cells of inner cell mass. Do you know what happens to these inner cell mass? This inner cell mass itself is the one which is going to become the embryo. Now I want you to see the above picture here. So this inner cell mass is the one which is going to divide further and it will form epiblast and hypoblast. Epiblast and hypoblast. Okay. There will be a cavity which forms inside this epiblast. That becomes the future amniotic cavity. And below in the hypoblast, you will see one more cavity, that is the yolk sac. When you actually see this on the ultrasound, it will look like 2 blebs. Do you know what is this called as? This is called as double bleb sign. So double bleb sign is amniotic cavity plus yolk sac. Double bleb sign is amniotic cavity plus yolk sac. So amniotic cavity plus yolk sac is called as double bleb sign. Amniotic cavity plus yolk sac is called as double bleb sign. I'll show you the picture of double bleb sign. Just write down as of now. Right, next. This epiblast and hypoblast is the one which is going to become the primitive streak. This epiblast and hypoblast will combine together and become the primitive streak. And you know further story, the primitive streak is the one which is going to develop into ectoderm, endoderm and mesoderm and form all other structures. Am I clear what is happening from the blastocyst to the embryo? Did all of you understand these steps? Any doubt till here? All of you understanding what I'm speaking? Can I get a thumbs up? Can you tell me where do we see double bubble sign? This is double bleb sign, no? That is amniotic cavity and yolk sac. Do you know where do we see double bubble sign? Where do we see double bubble sign? Yes, very good, Gurleen. So mainly in the duodenal atresia. Duodenal atresia. Annular pancreas will in turn lead to duodenal atresia, no? Duodenal atresia will present you with double bubble sign. Correct. Now in your own booklet, if you go down, last pages may have given you the pictures, guys. Last pages may have given you the picture. Ultrasound pictures I have given in the booklet last May. Can you open those pictures? I'll just show you the double bubble sign and everything, double bleb sign. So we are discussing few points about the ultrasound also. Point number 1. The minimum beta HCG to visualize gestational sac on TVS is 1500 to 2000 international units per liter. The minimum beta HCG to visualize the gestational sac on TVS is 1500 to 2000 international units per liter. And on TS, it is 5000 to 6500. So the minimum beta HCG to visualize the gestational sac on TVS is 1500 to 2000, whereas on TS it is 5000 to 6500. So whenever beta HCG rises till this level, then only you will be able to see the gestational sac. So TVS means transvaginal sonography, TS means transabdominal sonography. So transvaginally, when you're taking the probe, that is when you're going to see the gestational sac more better, no? Now first thing, whenever they give you ultrasounds, it's very difficult to understand what organ they are asking. Don't you agree with me? सबसे पहले ये TVS है कि TS कैसे पता लगाएंगे? Whenever you see a bladder window like this, it is TVS. Now please observe, you're having the uterus. This is the uterus. Can you delineate, can you understand once I show you what is the uterus? This is the uterus. दिख रहा है ना uterus, anteverted, anteflexed. Always remember, this white line is the endometrium. White line is the endometrium. What do you think is this black sac? What do you think is the black sac? Come on, guys. I want all of you to be active and answering. ये black sac क्या है? That black sac is nothing but the gestational sac. That is nothing but the gestational sac, right? Now, gestational sac will never go and sit in the center. Correct. Very good, Gurleen. So that is nothing but the gestational sac. Now, this gestational sac is little below the endometrium. Can you see? This is the endometrium. This is the gestational sac. So this is eccentric in position. Gestational sac is eccentric in position. A true intrauterine pregnancy, gestational sac will be eccentric. Now I'll show you one more picture. आपके बुकलेट में ही और एक पिक्चर है. यहाँ भी can you see this is the uterus? This is the gestational sac. पिछले वाले पिक्चर और इस पिक्चर में अंतर क्या है? Where is the gestational sac in this picture? In this picture, if you are observing, the gestational sac is present in the... Yes, Raj? The gestational sac is present in the center. It's extremely in the middle. अभी हम कोई कार पार्क करते हैं तो पार्किंग लेन्स में रखेंगे ना, सड़क के बीच में थोड़ी ना रखेंगे. तो this is a pseudo sac. This is a pseudo sac. It's actually not a pregnancy. It's somewhere ectopic or something, but it is looking like a pregnancy inside the uterus. So this is called as pseudo sac. If you observe, don't you observe that the gestational sac is in the center? So it is in the center of the cavity. Normal, a true gestational sac should be eccentric. So write down for this picture, this is a pseudo sac. Pseudo sac is central in position. It is asymmetrical. There will be no double decidual sign. As of now, just write down no double decidual sign. I'll explain you what is no double decidual sign. This is about the pseudosac. This is about the pseudosac. Now go back to the true gestational sac. This is the true gestational sac. The first sign of intrauterine pregnancy is, all this you should tell when I'm teaching you ectopic pregnancy again. Okay? The first sign of intrauterine pregnancy, IUP, intrauterine pregnancy, is gestational sac is eccentric in position. Gestational sac is eccentric in position. It will be symmetrical. Double decidual sign will be positive. Double decidual sign will be positive. And this gestational sac being eccentric in position, this is actually called as intradecidual sign. Intradecidual sign. And these are the features of true gestational pregnant sac. True gestational sac. So these are the features of true gestational sac. Okay. Next. So this gestational sac on TVS, that is transvaginal sonography, gestational sac will be seen around 4 weeks plus 5 days. Yolk sac will be seen around 5 weeks. Fetal pole will be seen around 6 weeks. Fetal heart rate also will be audible by 6 weeks. तो बहुत बार ऐसा होता है कि किसी का यूपीटी पॉजिटिव होता है. So यूपीटी पॉजिटिव होने के तुरंत, can you do if you do an ultrasound, will it be any benefit? Now I have seen a patient who has come to me telling, doctor, I've missed my periods. I did a UPT and UPT is positive. Now can I do an ultrasound immediately to confirm her pregnancy now? Will it be of any benefit if I do her ultrasound now? Yes, guys. There won't be of any benefit. See, if she has missed her period just now, she's around 4 weeks. So 4 weeks में if I do ultrasound, I'm not going to see anything, no? Minimum 5 weeks. And if I want to confirm that it is a real, like baby का heartbeat भी आया हुआ है, तो better to do it at around 6 weeks. So आपके कोई आस पास में अगर कोई pregnant है and they want to get an ultrasound, आप उनको क्या कहेंगे? Wait up to minimum 6 to 7 weeks. है ना? If they want to get a transabdominal, all this will take more time to visualize on transabdominal. At least 1 week more. So better ask them to get an ultrasound at around 7 weeks. Right? Okay, now I'll ask you one more question. So her UPT is positive, but she's asking you, doctor, am I 100% pregnant? UPT is not going to tell you 100%. UPT मतलब urine pregnancy test जो घर में देखते हैं 2 लाइन आता है, तो ये 100% definitive नहीं है. So what is a test which you can do to confirm the pregnancy 100%? think and answer. Till then, I'll just tell you about this ultrasound. Good question. So all these what I have written is from the LMP. All these 4 weeks plus 5 weeks, 5 weeks, 6 weeks, 6 weeks. All this is from LMP. LMP. Yes, from LMP. Very good. Excellent. So for the patient, you have to do beta HCG. For patient, if they want to confirm the pregnancy, do serum beta HCG. Serum beta HCG. All of you are correct. Very good. Chalo, please understand this picture now. This is the gestational sac. This is the yolk sac. This is the fetal pole. So from the fetal pole, you will be able to hear the fetal heart rate. Okay. So usually gestational sac will be covered by 2 rings. It's not very clear, but it will be covered by 2 rings. That we call it as double decidual sign. Double decidual sign. It is not very clear, to be frank. See, this is the same picture, but yes, this is gestational sac. If you can see, there's one more ring around the gestational sac. That one more ring around the gestational sac is called double decidual sign. In this picture, you're seeing this is the gestational sac. Can you see this is the yolk sac and this is the amniotic sac? So in between you'll have that embryonic disc. If you see yolk sac and amniotic sac like this, what do you call this sign as? Yolk sac plus amniotic sac, what do you call this sign as? Double क्या है? Double bubble, double bleb, double decidual. This is nothing but the double. Yes, double bleb sign. Double bleb sign. So double bleb sign has been asked as an MCQ, guys. Double bleb sign has been asked as an MCQ. So all the 3 doubles are important and has been asked as an MCQ. Double bleb sign. Double bleb sign. Correct. All of you are correct. So double bleb sign is yolk sac plus amniotic sac. Right. Till here, all these are first trimester important ultrasound pictures. All these what we have seen till here are the important ultrasound pictures for the first trimester. Right, let's go back. So I told till day 5. Day 5 I taught you 2 things. One is blast. Okay. Right. So blastocyst, I told you that you have outer trophoblast, inner cell mass and antrum. Now I'll speak some points regarding the trophoblast, guys, the outer trophoblast. So day 8, trophoblast differentiates into Day 8, trophoblast differentiates into outer syncytio, outer syncytio, outer syncytio trophoblast and inner cytotrophoblast. And inner, there will be two layers of this trophoblast. Outer layer will be syncytio. Syncytio means there will be only nucleus, but the cell wall won't be retained. Inner cytotrophoblast. Cytotrophoblast is also called as Langerhans cells. Langerhans cells. So outer syncytio and inner cyto. Syncytio is multinucleated syncytium without cell walls. This is the hormonal factory of the placenta. आगे जाके this trophoblast is the one which will become the placenta. So outer syncytio trophoblast will secrete all the hormones. So syncytio trophoblast is the hormonal factory of the placenta. Inner cytotrophoblast will be, it will be mainly single layer cells. So this inner cytotrophoblast will again further divide into So I think we'll write down in the next page regarding the, you can write down in the next page available regarding the cytotrophoblast. I'll write some points. Implantation वाले पेज में लिख देना. Cytotrophoblast, some of the cytotrophoblast will form finger-like projections, some will not form finger-like projection. So those which form the finger-like projection, they are called as villous cytotrophoblast. Another part of which is not forming, they'll actually invade the spiral artery. They are called non-villous cytotrophoblast. So what I want you to understand is, outer to that blastocyst, you have single layer of cells that is called as cytotrophoblast. Okay? These outer to the single layer of cytotrophoblast, you again have one more layer that is called as, which is multinucleated, that is called as syncytio. Inner layer is the cytotrophoblast. This cytotrophoblast will, one part will form finger-like projections. That finger-like projections is going to become the future placenta. Some of the cytotrophoblast will go and invade the spiral artery. Spiral artery will come from this side into the mother, from the mother. Okay? This, some of the non-villous cytotrophoblast, they will go and invade the spiral arteries. That about the non-villous cytotrophoblast, I will tell further points while I am discussing the chapter of preeclampsia. See, if I load you too much knowledge at one session itself, it becomes too confusing. As of now, आप बस इतना याद रखो कि non-villous cytotrophoblast भी है जो actually spiral arteries को invade करेगा. And that I will give you more clarity when I'm discussing preeclampsia chapter in a beautiful manner. ठीक है? अब villous cytotrophoblast में will finger-like projections will be present all over the blastocyst, or it should be present only one side? It will be present only one side wherever the placenta will develop. So wherever the placenta develops, there when it forms the villous cytotrophoblast, That part is called as, so it forms villus, villi-like structure near Decidua basalis. I will tell you this. Give me just few minutes. I'll explain you about this. This is called as chorion frondosum. Rest of the villus cytotrophoblast will be smooth, remain smooth. That we call it as chorionic levee. Chorion levee. Okay. So only one place it forms placenta, and that we call it as chorion frondosum. Rest of the portion it will be smooth, that we will call it as levee. As of now, just write this. I will tell you further in just a few minutes. So day 5 blastocyst will develop. Day 5 zona hatching will happen. Day 8 trophoblast will differentiate into outer syncytio and inner cytotrophoblast. ठीक है? Cytotrophoblast again will have villus and non-villus. Villus can form chorion frondosum and chorion levee. Next, day 6 implantation begins. Day 6 implantation begins. Day 6 implantation begins. Day 10 implantation ends. What is the most common site of implantation? The most common site of implantation is posterior wall, upper two-third, body of the uterus. Posterior wall, upper two-third, body of the uterus. All of you are going to the labor ward and all, no? So, if there is a fibroid, anterior, imagine there's one patient with anterior wall fibroid, there's one patient with posterior wall fibroid. Who is more likely to get pregnant without any treatment to the fibroid? Anterior wall fibroid or posterior wall fibroid patient? Personally, this I have seen in the patients. So आजकल fibroid बहुत common है. तो अगर किसी patient को anterior wall fibroid है, they get pregnant. Yeah, it's like even though they have fibroid, still they can get pregnant. But if there is a posterior wall fibroid, most of the time they land up in abortions, recurrent abortions. Why? हाँ करेक्ट एंटीरियर वॉल प्रेग्नेंट हो जाता है, प्रेग्नोसिस बेटर होता है. बट इफ इट इज अ पोस्टीरियर वॉल फाइब्रॉइड, देन इवन दो द साइज ऑफ द फाइब्रॉइड इज स्मॉल और लाइक दैट, still they land up most of the time in abortions. Okay, because implantation gets hindered, no? So what are the steps of implantation? There are 3 steps: apposition, adhesion, invasion. So there are mainly 3 steps: apposition. Now again here just remember the names, no need to go further ki kya hai and all. बस नाम याद रखो: opposition, adhesion, invasion. Opposition, adhesion, invasion. Okay. Most common type of implantation is interstitial implantation. It doesn't go deep, it will be only in the endometrium. So that we call it as interstitial implantation. So most common type of implantation is interstitial implantation. day 10, minimal pervaginal bleeding can be there. This we call it as implantation bleeding. Day 10 means which day of the menstrual cycle? Day 10, you can see little bleeding per vaginum. Means which day of the menstrual cycle? Day 10. This is day 10 post fertilization. Right? So day 10 means which day of the menstrual cycle? Day 10 plus 14 means day 24. So actually this bleeding will present to you with premenstrual spotting. So most of us will think that okay, our periods are going to come, but actually they're going to be pregnant, है ना? So implantation bleeding is physiological. बस एक दो डॉट दिखेंगे या एक दिन थोड़ा bleeding दिखेगा जब implantation खत्म हो रहा है. Then what happens? It becomes normal. You don't require to treat this. Okay, yes, day 24, correct. Now I'll show you the pictures of apposition and all. So apposition mein first what will happen? The zygote, the blastocyst will just get opposed to the endometrial wall with the help of some small projection. These are called pinopods. These are called pinopods. Okay. Next, what will happen? This will invade the endometrial epithelium with adhesion molecules. These adhesion molecules are integrins, selectins, proteoglycans, fibronectins. All these are called adhesion molecules. Next, what will happen? It will invade. See, invasion, it is producing finger-like projections. Can you see the finger-like projections? So these finger-like projections, invasion is mainly by serinoprotease, metalloprotease, collagenase. Now you'll ask, ma'am, what I should remember? Don't remember all these. Just remember the steps. That is opposition, adhesion, invasion. That's all. Steps, if you remember, more than enough. Now what is important is not this what molecules is helping in what. That is like just theoretical. What is very important is this picture, guys. Anatomically, is this picture clear? All of you are able to see the picture? Anatomically, after the implantation takes place, decidua is divided into three structures. The part of the decidua which is present below the blastocyst, this part is called as decidua basalis. See the part of the decidua, this one which is present below, this is called as Decidua basalis. The part of the decidua which is covering the baby, this part is called as Decidua capsularis. And the part of the decidua which covers the entire uterine cavity, this is called as Decidua parietalis. Did you understand all the three names of decidua? Easy it is. If it is present below, you are going to call it as basalis. If it is covering the baby, then you are going to call it as capsularis. When it's covering the rest of the uterine cavity, you are going to call it as parietalis. Right? So this is basalis, this is capsularis, and this is parietalis. Correct? Now, baby will not be always so small. Baby will keep growing. But before we go for that, can you see? I'll just zoom it further. Baby is also covered with two membranes. The trophoblast itself will form two membranes. The inner membrane is called as amnion. The inner membrane is called as amnion. The outer covering what you're having, that is called as chorion. And I told you, chorion may will have two parts. The villous trophoblast, which is forming finger-like projection, this is called as chorion frondosum or chorion villi. And the chorion which is smooth and not forming any finger-like projection, this is called as chorion levae. Chorion levae. So this is called chorion frondosum and this is chorion levae. Am I clear, guys? So this is chorion frondosum and this is chorion levae. Inner to chorion, you will have amnion. Inner to chorion, you will have amnion. Correct. Amnion is inner, chorion is outer. Amnion is inner, chorion is outer. And in chorion, again two parts. Chorion frondosum and chorion levae. Most of the time, actually, you cannot see chorion and amnion as two separate layers, guys. They're like full चिपका fight. मतलब दोनों चिपक के रहते हैं. ठीक है? अभी क्या करेंगे? This picture only, if you see, as and when the baby keeps growing, the Decidia capsularis and parietalis will fuse with each other. And then it becomes single layer, that we call it as Decidia vera. That we call it as Decidia vera. So I'll show you the picture of Decidia vera. See, this is Decidia vera. This is Decidia vera. Okay. So at how many weeks? So even those who are going to give theory exam, you have MCQs in the theory also, no? So recently I have seen one student send me the question paper. They have asked this question, at how many weeks you will see Decidia vera. So this is important for your MCQ in the theory exams. So at 16 weeks, Decidia capsularis fuses with Decidia parietalis and it forms Decidia vera. At 16 weeks, Decidia capsularis fuses with Decidia parietalis and it forms Decidia vera. Very good. Correct, Raj. So actually it is 14 to 16 weeks, but if you answer 14 to 16 weeks, I have seen like precisely they are asking like again 12, 14, 16. So better yaad rakho 16 weeks karke. Range, if you have to remember, 14 to 16 weeks. This, when you see it on ultrasound, you will see that this as a gestational sac with two rings. That we call it as double decidual sign. So you can remember double decidual sign is due to Decidia capsularis. You can remember it as cap, guys, cap. Double decidual sign is due to Decidia capsularis plus Decidia parietalis. This gestational sac around, you are seeing two membranes, no? On ultrasound, this will look like two rings around the gestational sac. This we call it as double decidual sign. So I have taught you three doubles, guys. I have taught you three doubles. Again, this also has come as an MCQ. What are the layers which form the double decidual sign? Remember it as cap, capsularis and parietalis. Capsularis and parietalis. So what are the three doubles I have taught you now? Double bleb sign, double bubble sign, double decidual sign. Correct? Now I'll show you a picture. You have to answer what layer is what. Okay? Let us start from this picture. What is 3 in this picture, guys? What is 3 in this picture? What is the 3 in this picture? So this is present below the blastocyst. So this is Decidia basalis. Decidia basalis. What is 1? One is covering the entire uterine cavity. So one is Decidia parietalis. One is covering the uterine cavity, no? Parietalis. What is 2? 2 is capsularis. 4 is uterine cavity. 4 is uterine cavity. Correct, correct. Very good. Now this picture. What is 6, guys? What is 6? Please observe properly what they're asking in the 6 and answer then. 6 is towards the fetal side and 6 is the one which is forming finger-like projections. So what are you going to call the 6 as? 6 is chorion. As it is forming finger-like projections, you are going to write as chorion frondosum. Correct. Very good, Gurleen. So it is chorion frondosum. What is 5? What is 5? 5 is chorion levae. It's not forming any finger-like projections, no? So that is it. That is why it is chorion levae. What is 8, guys? 8 is towards the mother's side. What is 8? 8 क्या है? Very good, Yuvraj. Correct. 8 is Decidua vera. 7 is amniotic cavity. Very good. Excellent. Now, I want to tell you one last concept here. So, this I want you to understand. See, up to 16 weeks, uterine cavity is open. Uterine cavity is still open up to 16 weeks. Every month, whatever is my menstrual date, little amount of bleeding happens through this open cavity. And that we call it as placental sign या Hartmann sign. Placental sign or Hartmann sign. I repeat this once again if you have not understood. Up to 16 weeks, uterine cavity is open. So little bleeding can happen through this open uterine cavity. That we call it as placental sign या Hartmann sign. Placental sign या Hartmann sign. So write down that point. Write down that point. So up to 16 weeks, minimal pervaginal bleeding, coinciding with LMP. This we call it as Hartmann sign or placental sign. Okay. What was the another bleeding which I taught you? What was the another bleeding which I taught you? I also taught you one more bleeding. Most students confuse between implantation bleeding and placental sign. Placental sign will coincide with her LMP and it is up to 16 weeks. Implantation bleeding is only on 10th day after fertilization. Yes. दोनों में अंतर समझ में आया ना, क्योंकि they can ask you this as a clinical scenario. You should be in a position to answer. Again, this is physiological. Again, this is physiological. So that finishes everything about the implantation, guys. So I will quickly recap a few points about implantation and then we'll go further for the MCQs of this chapter. So I'll start from the fertilization. So fertilization is fusion of male and female pronuclei, right? Where does the fertilization take place? I didn't write the site of fertilization. Where does the fertilization take place? Site of fertilization is ampulla of the fallopian tube. So you can tell amplo-isthmic junction, but most of the time when students tell amplo-isthmic, they forget they again, if you have the option of ampulla and isthmus, you will be like confused whether to answer ampulla or whether to answer isthmus. So better to answer ampulla. No, no. Placental sign and implantation bleeding are not same. Placental sign and Hartmann sign is same. Placental sign is different. Implantation bleeding is different. Implantation bleeding takes place when implantation finishes. Am I clear, Raj? This actually has been given wrong at some places also. That's why I want you to know the difference between both of them. Okay? Right. So I will tell day by days. You tell what will happen. Day 3, what happens? Day 3, what happens? Day 3, morula develops. Day 3, morula develops. Day 3 to day 4, morula enters the uterine cavity. What are the two things which are happening on day 5? So day 5, blastocyst will develop and zona hatching. Day 6, implantation begins. Day 10, implantation ends. Day 8, trophoblast will differentiate into outer syncytial and inner cyto. Which is the hormonal factory of the placenta? Which is the hormonal factory of the placenta? Yes, syncytial trophoblast. So अगर आपको एग्जाम में याद नहीं आता है, somebody is asking HCG is secreted from where? Then you answer morula, क्योंकि morula is then you answer syncytial trophoblast because most of the hormones are secreted from syncytial trophoblast itself. Excellent, very good, very good. Next, syncytial trophoblast is multinucleated. What is Langerhans cells? Langerhans cells or cytolytic activity is all present in the cytotrophoblast. Cytotrophoblast is Langerhans cells, right? They form finger-like projections. There are two villous and non-villous. Villous mein again you have chorion frondosome and chorion leve. Non-villous will cause spiral artery. They will enter the spiral artery and cause invasion of the spiral arteries. Okay? What is double bleb sign? What is double bleb sign? So double bleb sign is amniotic cavity plus yolk sac. What is double bubble sign? Double bubble sign is seen in duodenal atresia. What is double decidual sign? Very good, very good. Double decidual sign, you can remember it as cap. Capsularis and parietalis. Capsularis and parietalis. Chalo, correct. Most common site of implantation is posterior wall, upper two-third body of the uterus. Steps are apposition, adhesion and invasion, right? 16 weeks may you will see Decidua vera. 16 weeks may you will see Decidua vera, right? Now last question. Double decidual sign is visible up to how many weeks? Double decidual sign is visible up to how many weeks? Double decidual sign will be visible only up to 16 weeks. Because after 16 weeks, Decidia vera will form, no? Because of the fusion of capsularis and parietalis. So, double decidual sign won't be seen. Correct. What is the first sign of intrauterine pregnancy? What is the first sign of intrauterine pregnancy? That's what. When will you call it as true gestational sac? Only if true gestational sac is. How will you differentiate that this is a true gestational sac? Yes, the first sign of intrauterine pregnancy is intradecidual sign, where gestational sac is eccentric in position. Gestational sac is eccentric in position. Absolutely correct. Very good. Very good. I'm happy that you're all listening. Chalo, let us solve some MCQs now. Let us solve some MCQs. I want you to arrange sequentially. This all यहाँ पे जो दिख रहा है ना, इसको आप sequence में arrange करके you tell me what should be the sequence. Arrange it sequentially and tell me the sequence. So I am giving you some time for you to answer. So first will be Oogonia, E, followed by, after the Oogonia, what will happen? Primary oocyte will be there, A. Why did you give numbering? Yeah, 1, 2, 3. Right. So I have the answer of EACBD. Let me check whether you have answered it correct. Most of you are answering EACBD itself. So E is Oogonia, correct. A, primary oocyte, correct. Yes, first polar body will release first, followed by secondary oocyte. So C, followed by secondary oocyte, followed by second polar body. EACBD is absolutely correct. You all can, it's absolutely correct. EACBD. Now, next question. You have to answer me which among the following statement is wrong, or you answer which statement is correct. Primary oocyte is formed after single meiotic division. Yes. Can you answer which all statements are correct here? First this question. Second wala question. Primary oocyte के बारे में. It is formed after single meiotic division. It is in prophase arrest. Maximum in number in 5th month old filters. It is also called blastocyst. Tell me what are the true options. Tell me what are all the statements which are correct. Yes, primary oocyte is in prophase arrest is absolutely correct. Very good. Maximum in number in 5th month old fetus is also correct. It is formed after single meiotic division is wrong. It is not formed after single meiotic division. It is formed after single mitotic division. It is formed after single mitotic division, not meiotic division. So A is wrong. It is also called as blastocyst. Why will this be called as blastocyst? This is also wrong. So answer here is B and C. Now read the next question. Tell me the true statements regarding oogenesis. Tell me the true statement regarding oogenesis. I know there are so many statements, but still you can answer. Primary oocyte arrests in prophase of first meiotic division. Okay, so I have the answer from Gurlin as A, D, E. Let us see A, D, E are correct. So primary oocyte arrests in prophase in first meiotic division. I told primary oocyte everything first. So this is correct statement. Primary oocyte arrests in prophase of second meiotic division is wrong. Secondary oocyte, I told you all second. So secondary oocyte arrests in metaphase of second meiotic division, absolutely correct. Not first. First polar body is extruded during first meiotic division of primary oocyte, correct. This is also correct. So A, D, E are absolutely correct. E is also correct, no? First polar body is extruded during first meiotic division only, no? Zygote reaches the uterine cavity as 32 cell, 16 cell, 8 cell, 2 cell. So zygote reaches the uterine cavity as 16 cell morula. 16 cell morula. Correct? So now we'll go for the... So if you have missed anything writing there, you can always write it in the notes also. You have an additional page. So we'll take... Do you want to take a break and then start back? Right. Fetal heart rate on TVS appears when? Yeah, one last thing I forgot to mention. See here, intrauterine period is from ovulation, fertilization to 2 weeks. Embryonic period is 3 weeks to 8 weeks. Fetal period is 8 weeks to till delivery. If they ask you from LMP, yes, fetal heart rate on TVS is by 6 weeks. From LMP means you have to add 2 weeks. Ovular or germinal period is up to 4 weeks. 5 weeks to 10 weeks is the embryonic period. Beyond 10 weeks is fetal period. Among these three, embryonic period, ovular period and fetal period, which is the most important period, guys? Among these three, ovular period, embryonic period and fetal period, which is the most important period? Embryonic period is the most important because organogenesis takes place here. So teratogenesis also is maximum in this period itself. So as organogenesis takes place in embryonic period, teratogenesis is also in the embryonic period itself. Okay. Right, guys. So you can take a break and come back in 15 minutes. So you can all assemble back by 7:10. 7:10. Okay. Till then, if anybody has any doubt, they can message me. So you can all assemble back by 7:10.